Healthcare workers and residents in the northwest say the closure of Thusong District Hospital has left them stranded and frustrated. Previous reports indicated that the hospital was built on dolomitic soil, and the provincial health department resolved to relocate the facility. Our reporter Refiloe Seboko is joining us live now. Refiloe, good morning to you. It must be frustrating indeed for the residents of that community. Where do they get health services now?
Good morning, Xoli. It is really frustrating for the residents of Itsoseng, Budibe, Fordwal, Springbok, Bani, Kolini, Sheila as well. These residents were provided healthcare services by this hospital, Thusong Hospital, but following that announcement of its closure, the healthcare workers together with the residents of the areas that I had mentioned are saying that they are very frustrated and are left stranded as they are struggling to access healthcare services that is closer to them. But I'm joined by Baby Makheledisa. She is a land activist. She says, Xoli, that she does not believe at all that there's a dolomite here. Thank you so much for your time and welcome to Newzroom Afrika. What's your reaction in the closure of this hospital?
The closure was actually a shock to all of us because the only room that was prescribed as was heating was the dispensary. But in all honesty, you cannot close a hospital because of the dispensary room was overheating. And previously, I think on the 29th of last month, we met with the other geologists that were surveying Thusong Hospital, and they actually told us that if this hospital can be maintained or was maintained before, it could have saved our communities for more than 100 years. So the only thing is that we don't know what was happening with the budget of Thusong, because since 1994, Thusong was never taken care of. And in all honesty, if you can ask the health department, what did they do with this hospital's budget? I don't know if they'll have answers for you. And I would like to tell the people that dolomite has been there for over 6 million years, and it's a formation of the earth. And there's no way that a dolomite can start from Johannesburg, as the spokesperson of the health department was telling the radio station, that dolomite that's disturbing our hospital, it's coming from Johannesburg. Why all the buildings in Johannesburg are not collapsing? Why all the buildings in Johannesburg are still intact and they are maintained? This hospital is not closed because of this dolomite. This hospital was closed because of lack of administration, maladministration, lack of maintenance, and also mismanagement of funds, because I do not think that if there was a proper budget for this hospital, it should have been the way that it is today.
Let's talk about the march that you have organized for today together with the residents. What's the march really all about, and how much of an inconvenience this has been to the residents?
It's such a big inconvenience for everybody, let alone us people who can still walk and do other things. It's an inconvenience to old people, to people with disabilities, to everybody, to all the people. That there were more than 24 villages that were using this hospital. The townships, the towns, small towns around here, the farm workers, everybody was using this facility. But it's a shame today, and it's actually a disgrace to think that our government that we voted for does this to people.
Thank you so much, Xoli. Let me just move away from short just a bit. I'll show you the hospital. As you were asking, how are the residents accessing the services following the closure of this hospital, Xoli? The Department of Health has said that residents of the areas that I mentioned will be provided by healthcare services by General de la Rey Hospital, which is in Lichtenburg, together with Itsoseng Community Health Care Center, which is in Itsoseng. And Xoli, you also remember that the Northwest Department, following the closure of this hospital, they said it's as a result of safety concerns, and investigations into the cause, together with a decommissioning process to formally shut down the hospital, are underway. They are just on that. It's an issue of safety, and this is why they are taking a decision to shut down the hospital altogether.
Refiloe Seboko, very, very sad situation for the residents of that community. Thanks indeed for that update.